Well, hello again, beautiful people, and welcome back to another session of Do It Right with Dr. Ansu. That's me. In my last couple of videos, I had talked about carpal tunnel syndrome and showed you how I use osteopathic manipulation in those cases, along with some stretches in between to help relieve the pain without using a whole lot of medications. Today, we're going to switch gears and go from the musculoskeletal to the non-musculoskeletal to show you how osteopathic manipulation can be beneficial in a different situation, particularly acute sinusitis. So let's get started. So first of all, let me just start off by saying acute sinusitis does not equal bacterial sinus infection. It may be sometimes the case, but not always. So if you are feeling any sinus symptoms, any pressure or congestion for the last couple of days without any fever or significant tenderness, please do not call your doctor expecting antibiotics. It's just not the right treatment. If you don't believe me, let me share some facts. Acute sinusitis, or more accurately, acute rhinosinusitis, which includes your nasal passages along with your sinuses, is one of the most common conditions we see in the outpatient setting. In fact, 1 in 7 adults experience acute sinusitis symptoms. That is about 37 million people in the United States alone a year that are coming across symptoms of acute sinusitis. Let me put that into perspective. Acute sinusitis affects more people than heart disease and asthma, and has greater impact on quality of life more than chronic back pain or congestive heart failure. If you've ever suffered from sinus pressure, you know exactly what I'm talking about. It can affect you physically. You're congested, you've got a headache, a lot of pressure. It can make you feel foggy, which affects you mentally because that only affects how well you're doing your job, or if you're in school, you're having a hard time focusing. It can kind of slow you down a little bit. It affects your sleep, which causes increased stress level, which can therefore affect you emotionally. But also, it's not cheap. Between outpatient visits, ER visits, specialist visits if you need to, over-the-counter medications, as well as prescription medications, and sometimes even procedures, the direct cost related to acute sinusitis is well over $8 billion a year and can cost over 73 million workdays a year in the United States alone. It's also mostly a viral infection. In fact, only about 2% of the patients who have acute sinusitis truly have a bacterial infection, but about 80% of the folks who are being seen for acute sinusitis are being prescribed antibiotics. I want you to think about that for a second. Something that is known to be a viral infection being treated with antibiotics, which is not the right treatment to begin with, and patients are wondering either why they're not getting better, or they're getting better, but not necessarily because of the antibiotics, but because it was viral and was kind of getting out of their system to begin with. I'm all about examples, so let me share an example with you. Imagine a clogged pipe in your house, whether that's a bathtub pipe or a sink pipe, and water is starting to build up. When this happens, is your first instinct to call the plumber and get that fixed and spend hundreds of dollars, or to go to the grocery store and get some liquid plumber or Drano and pour it in to see if that fixes the problem? Most of the times that fixes the problem, and you don't have to go a different route. That is how sinusitis works. It's a problem of blockage, and quite often if you help release that blockage, everything properly drains through without requiring antibiotics. This is where osteopathic manipulation can be very helpful. So what is sinusitis? Let me give you a quick anatomy lesson, because once you visualize what I'm talking about, everything I say will make a whole lot more sense. So you've got these things called sinuses, which are these air pockets behind our facial bones. They're primarily in this region. So, when you feel that stuffiness, that pressure is usually right here. You've got your frontal sinuses, which are behind your forehead. You've got your maxillary sinuses, which are behind your cheekbones. And you've got your sphenoid and ethmoid sinuses in between your eyes and the bridge of your nose area. The whole purpose of sinuses is to humidify the air that you're breathing in and to clean it and filter it before it reaches the lungs. It also affects the way you sound. So if you are sounding nasally because you're congested, it's because the shape and the volume of your sinuses is affecting how you sound. The sinuses are covered with a thin mucus layer along with some hair cells called cilia. These two work together to trap the germs and pollutants that you're breathing in, from the air, and they move it along to the back of the throat so you can swallow it and it goes out of your system. The sinuses are also connected through these openings called the ostia, and this proper drainage is essential to keeping your sinuses healthy. So in acute sinusitis, what happens is that thin mucus layer that we were talking about gets inflamed. This could be from a viral infection, a bacterial infection, allergies can do it, and essentially that inflammation causes swelling of that mucosal line, which causes the ostia, that opening, to close up, which increases the mucus buildup in your sinuses. This affects the movement of the hair cells, and now suddenly it can't move things along too well, causing more buildup of mucus, and therefore over time this just causes increased fluid buildup, mucus buildup in your sinuses. So the next time you are feeling that pressure in this area, just imagine it's because there's mucus being built up, not necessarily because there's bacteria. It's just their pressure from the mucus that's built up, and we need to help with the drainage process. There are also other risk factors for acute rhinosinusitis, including history of smoking, allergies, asthma, dental disease, if you recently went flying or deep sea diving, any kind of atmospheric pressure changes, weakened immunity, or if you're on medications that weakens your immunity, all these can cause you to have recurrent acute sinusitis. So what are some of the common symptoms of acute sinusitis? Well, most commonly we see nasal stuffiness or congestion, particularly in this area. There could be some facial pain or pressure. You don't always have to have pain. Worsened with movement. So if you were bending down and getting up, it's more obvious. You can have some postnasal discharge, because things are kind of draining to the back of the throat. You can have discolored discharge coming out of your nose, or sometimes coughing it out, usually a yellow, greenish in color. You can have headaches, frontal headaches, if your frontal sinuses are involved. You can also notice some dental pain because of the pressure being built up. Some associated symptoms could include coughing, fever, fatigue, loss of taste or smell, and sore throat. Please note that having these symptoms does not distinguish whether you're having a viral infection or a bacterial infection, because the symptoms overlap for both types of infection. The thing that helps us is the clinical course, so usually viral infections, just like any viral infection, usually lasts about 7 to 10 days. Sometimes it can linger on, but the symptoms are a lot better after 10 days, versus bacterial infection usually tends to be just as significant even after 10 days. Sometimes you can have what we call a biphasic pattern with the bacterial infection, where the symptoms are pretty high and then within 3 to 4 days they get better, and then there's a worse pattern around 5th or 6th day. Those are usually signs of bacterial infection also. Other things that suggest a bacterial infection is persistent fever greater than 102 degrees Fahrenheit or 39 degrees Celsius for the first 3 to 4 days, along with some significant tenderness in the sinuses, and puerile nasal discharge, that white gooey yellow discharge that comes up, and it's not just a couple of days, it's persistent for the first 3 to 4 days. That can also suggest that you may be having a bacterial sinus infection. So this is important. I cannot tell you how many times I have patients call me with a couple of days of mild pressure and expecting antibiotics, and I have to do a lot of teaching, telling them this sounds kind of like viral infection, and how about we wait it out, and you can do some of these things that I'm going to tell you, and if it worsens, let me know and we can put you on antibiotics. And that's usually not what they want to hear, because they're suffering and they want to feel better. And unfortunately there's this misconception misconception that antibiotics are what will make them feel better, which is not the case as I just described to you. So there are times where I have to tell my patients that, this is not what you need. Do some of these supported treatment and let me know. And because they're not satisfied, they will go to an urgent care or emergency room setting, and sometimes even to a specialist, and be placed on antibiotics and feel better. And they call me saying how, they're feeling better on antibiotics. And I always have to respectfully remind them that it may not necessarily be because they were on antibiotics. Rather, the virus was just taking its normal course of getting out of their body. This is a battle healthcare providers are constantly dealing with. On one hand, we're trying to take care of our patients and give them the best care possible without harming them. On the other hand, we're trying to satisfy them. And it is very hard sometimes to do both, because sometimes they just don't go hand in hand. So I hope through this video you can understand a little bit more about what you're experiencing the next time you have sinus symptoms, to know whether you truly need to go and get antibiotics, or if you can wait it out, do some of the supported treatment, and hopefully that's all that you really need to do. So what is usually the common treatment for sinusitis? If it's viral, there is no treatment for it. As I said, for viruses, they have to do its course and get out of your body. And usually that lasts for about 7 to 10 days. It is what it is. If it's bacterial, you can certainly be placed on antibiotics. But usually I recommend a lot of supportive treatment while we're waiting to see what happens. And that includes things like saline irrigation, your neti pot or some kind of a nasal irrigation system. I usually recommend steam inhalation to help humidify the nasal passages. Usually if it's allergies, sometimes I recommend antihistamines just to kind of address the allergic component. You can use inhaled or even oral decongestants. Warning, with inhaled decongestants you need to be a little careful, because if you're using it for more than 3 days, you can have what we call a rebound inflammation, and that can make your symptoms a lot worse. Sometimes we can prescribe them inhaled or oral steroids to help decrease that inflammation that's building up. We also recommend using something like guaifenesin, your Mucinex, to help thin out the secretion that's building up. And if you're having fever or pain, obviously your fever reducers or painkillers like Tylenol or Motrin. That is your supportive treatment. What I do for my patients is an additional step of osteopathic manipulation, which is a little hard these days because of telemed. I'm seeing a lot of patients via telemed, and I can't quite touch them and do the things I usually do, so I'm teaching them how to do it on their own, and I hope to do the same with you guys today. The goal of these osteopathic treatments is to essentially open up that blockage and allow more drainage to happen, so if you're feeling less pressure and your symptoms are slowly improving without requiring a whole lot of medications. I use my knowledge of the musculoskeletal system along with the anatomy of the facial bones as well as the lymphatic system to help address the proper treatment. So let's get started. But before we start, here's a disclaimer alert. Once again, to help me with my treatment is my husband, Roshan. And just to review the anatomy of the sinuses, we've got the frontal sinus right here behind the forehead, the ethmoid and sphenoid in between your nose and eyes, and your maxillary sinus right here around your cheekbones. So first we're going to start off with what's called direct pressure. Essentially, we're taking our fingers and tapping it gently on top of the sinuses. The purpose of this is to essentially loosen up the mucus that has built up there by these gentle pressures. So you just apply them gently in the area of the sinuses. Once you're done with the direct pressure, you move on to the next step called the effleurage. The whole purpose of this is that you take your fingers and you move them sideways on the sinuses. This is similar to the myofascial release we did last week with the carpal tunnel. You're essentially using your fingers and applying gentle, direct pressure to move the fluids around that's built up in the sinuses. You repeat this about 5 to 6 times. I'm taking my fingers, going across the frontal sinus, across the temporal bones, into the maxillary region. Then you take your thumb pads and you press underneath the eyebrow, and you do the same gentle pressures into the sides of the face. This time around, we're draining the lymph nodes and the lymphatic system, and just going from the middle into the sides. About 5 to 6 times. Next, we move on to the ethmoid and sphenoid sinuses, as well as the maxillary sinus. Again, gentle, direct pressure in the area of the ethmoid as well as the maxillary sinuses. And you want to make sure that you are not hurting the patient when you do this. It's just gentle pressure, gentle taps on the sinuses on both sides. Another form of direct pressure is just tapping directly on the sinuses without using the other hand to pat it. They're both the same. Now I'll follow this with the effleurage. Again, I'm taking my thumbs and I'm applying direct pressure on the nasal as well as the maxillary sinuses. And I'm moving it slowly, gently, even pressure to the two sides around the preauricular, which is right in front of your ears region. And I repeat this 5 to 6 times. Next, I move on to underneath the chin, the submandibular region. And I'm just going to move this a little so you guys can see it. And I'm taking my finger pads and I'm moving my fingers from the bottom of the chin to the sides. Again, 5 to 6 times, gentle, even pressure. And this is draining out the lymph nodes underneath your chin. And I will just show you from a different angle what this looks like. Here at the bottom of the chin, gentle pressure to the two sides, all the way up to close to your TMJ, all the way up the chin, and you're just applying gentle pressure. And then I have my patient turn their neck to one side as I do what's called a lymphatic drainage. So essentially everything we just drained from the face into the side of the face, now we're draining it down into the neck region, into the thoracic cavity. This is about 5 to 6 gentle pressures on both sides, essentially draining out all the lymphatic fluids that we just drained right in front of your ears, and we're taking them from the ears down into the neck and thoracic cavity. And once you're done with that, I usually have my patient straighten out and I do what's called a thoracic inlet release, where essentially I'm holding on to the clavicles and the first rib. I ask my patient to take a deep breath. As he exhales, I am just pressing down gently and just allowing that lymphatic fluid to move around. Next treatment we have is what we call the frontonasal disengagement. The purpose of this is to essentially apply gentle traction in opposite direction, with one moving towards the head and the one towards the body. And if you can think back to the anatomy, everything is connected with those osteas that tend to be blocked with acute sinusitis. And with this traction, we're applying pressure on the joint, allowing it to open up. Next, we follow with what we call milking or effleurage of the sphenoids and ethmoid sinuses. Essentially, we're applying pressure either with our index fingers or using the thumbs, the pads of the thumbs. Here, I apply pressure towards the center of the nose, but also slightly forward. And essentially, I am allowing the bones and the sinuses to essentially open up a little bit more with these gentle pressures. Again, with my index fingers, applying pressure on both directions towards the center of the nose, but also slightly forward. And now following with my thumbs, gentle pressure towards the center and forward. And I'm going to follow this up with the last treatment called the maxillary counterstrain. Anything counterstrain is applying pressure in one area for 90 seconds. So I'm going to take the sides of my thumbs and I'm going to apply pressure right here on the cheekbones, right above the maxillary sinus. And I am essentially pressing down and pushing. But as I push, I am putting pressure both to the center, but also forward. So I'm taking my hands and applying pressure both medially towards the center of the face, but also towards the front of the face. And I apply this pressure for about 90 seconds. And this just allows pressure on the sinuses, which helps move things along a little bit more. So now that we saw some of those treatments, you're probably wondering, well, how do I use this on myself? I want to let you know that you can certainly use the effleurage, which was the drainage to the sides, as well as the direct pressure, which was a tapping, on yourself. All you have to do is make sure you are laying back. Sitting down is not the most beneficial position. So just lay back, and kind of like what I was doing with my husband, you're essentially thinking about the sinuses. Think about the anatomy which I just showed you, and you're gently tapping in the various parts that we talked about, and then using either your finger pads or the sides of your thumb, whatever works well for you. You just want to make sure that you have equal gentle pressure. You are essentially going from the middle of your forehead and draining it to the sides. You can use the finger pads, your thumb pads underneath your eyebrow, and you're going to the sides. Remember, you're doing each of these treatments or each of these drainage movements at least 5 or 6 times. You're starting in the middle of your nose and you're going sideways. I like using my side of the thumb for the forehead and the sinuses, just because it gives a very gentle but equal pressure. So from the nose to the sides, and then using the thumb pads from your chin and into the sides. And then you look to one side and you are draining everything from this area down into your thoracic inlet, which is this part. And you do that a few times, and same on the other side. Okay, and I hope you use these treatments and see if it gives you some benefit, and you will feel improvement if you're feeling some of these symptoms, so let me know if you've tried it and how it's helped you. If you have any questions about any particular treatments that I did, please let me know through the comments, and if this was beneficial to you, please hit a thumbs up and like the video. I do want to say that, I was being a little overconfident when I thought I could do a video every week, but work and life and kids get in the way. So I am going to be moving this to a bi-weekly video submission. So I will see you guys in 2 weeks. I hope you enjoy the videos, and until then, please take care, stay safe, and until we see you again, to do it right with Dr. Ansu. Bye.